Welcome back to our channel here at Antai Hospital, and today we'd like to discuss infertility and sterility and also the services that are provided for these diseases at Antai Hospital. Now, many patients may recognize Antai for the treatment in recurrent miscarriage. However, we are firstly known for the treatment of infertility. Now, firstly, let's talk about the differences. Infertility and sterility are two distinct conditions. Infertility means you're unable to get the pregnancy outcome of having children, where these couples are actually engaging in sexual intercourse that is unprotected for over 12 months, and then they are unable to produce any pregnancy. Whereas sterility are people who have the inability to produce gametes, which means they are not producing egg cells or sperm cells that will in fact develop into a pregnancy. There is no formation of embryo at all. So we can say that sterility is actually under infertility, because infertility is a vast disease. It can include several distinct pregnancy outcomes and conditions, up to 150 individual conditions that can lead to infertility. So generally, when we classify, infertility includes sterility. It also includes recurrent miscarriage, natural miscarriage, ectopic pregnancies, molar pregnancies, late miscarriages where it's caused by short cervix or cervical insufficiency, and even hyperemesis gravidarum, amongst several other conditions. Because infertility, we are looking at the outcome because they are unable to get the pregnancy to full maturation. There is no children. However, they may be able to still get pregnant, but it ends up ending as well. But both conditions, infertility and sterility, have a similar outcome where they have no children. It's easily observable. But one is far vaster. It includes various subsets of different types of diseases that lead to the same outcome. So Antai Hospital is, in fact, not only specializing in recurrent miscarriage, we also specialize in infertility. And because many infertility conditions are closely related to recurrent miscarriage as well, so it's easily treatable as well. The first key step is, of course, diagnosis. We need to diagnose what is the underlying disease. Many doctors believe that infertility is random and it's sometimes natural as well. We are unable to avoid it. However, it is definitely caused by some underlying factor that was not diagnosed and is allowed to progress and grow into something much more complex. Infertility usually is much more complex than recurrent miscarriage because there are several factors that is causing it. So we need to actually do a full diagnosis first, and then step 2 is to seek out proper institutions, proper doctors that can actually treat these factors. So first of all, you need to keep in mind that there is no miracle drug or miracle treatment for infertility, because infertility, there's so many different types. So you need to treat your infertility according to what type of infertility that you are suffering from. It could be some problem with the sperm cells, it could be a problem with the ovaries, the fallopian tube, the uterus, or even your hormonal balance. All of these are factors. There are up to 150, as I mentioned. So you need to first figure out what is the underlying cause, which is diagnosis. Secondly, seek out medical experts that are specializing in the treatment of your cause. So let's say you have a problem with the uterus shape and size. Ideally, you want to find a hospital or doctor that is expert in the treatment of these types of uterine shapes and volume and also size. So you want to find the correct, proper doctor, and remember that there is no miracle drug. If any doctor is telling you there's a miracle drug for infertility, they're obviously selling you a scam. And lastly, is going for proper treatment. At Antai Hospital, we've already been doing treatment for infertility, recurrent miscarriage, hyperemesis gravidarum, late miscarriages, ectopic pregnancies for the past 20 years, and we are very familiar with the surgical techniques involved. It's always involving laparoscopic and hysteroscopic techniques. And at Antai Hospital, we actually guarantee the outcome, whereas other hospitals, they are not responsible for your treatment outcome. So what we do is that we guarantee that you will see healthy pregnancy and you will be able to get children that you want after our treatment for your infertility. Now, if you cannot do that, we offer you full refund guarantee, but usually we will be able to guarantee you full-term healthy pregnancy where you give birth to your own children. Whereas other institutions, other hospitals, they simply give you treatment, but they do not bear any responsibility for the outcome. So ideally, you need to find a medical institutions that is not only an expert in that form of treatment, they need to be giving you some form of guarantee, bear some form of responsibility towards treatment outcome, because these patients have already been suffering tremendously in both spending so much money in getting proper treatment, and they are still unable to get children. So ideally, as medical practitioners, we need to bear the responsibility for giving them proper treatment quality and also assuring treatment outcome, which all can be done here at Antai Hospital. So Antai Hospital not only treats recurrent miscarriage, we also treat all forms of infertility. Key steps are to diagnose, find the medical expert to treat that condition, and let them bear responsibility for the treatment outcome. So if this video helped you, or if you'd like to seek treatment with Antai Hospital, please get in touch with our consultants via the website, via the email, and also leave me some comments down below as well. I'll see you in the next one.